Caps are changed every 7 days. Sometimes this is done after the dressing is changed, but it may be done on its own.
Most likely you try to get your caps to be changed on the same day as your dressing. You don't have to. Some people have them separate and they can keep up in their mind when that is.
The first step is preparation. This involves cleaning your hands or performing hand hygiene, cleaning the workstation you will be working on, laying out the supplies, and then cleaning your hands once more. If you have questions about cleaning your hands or setting up your workstation, refer to the section titled Changing the Dressing.
So I've cleaned my surface. Now I'm going to gather my supplies. I have an alcohol wipe, my cap, and my pre-filled syringe.
The syringes will be pre-filled with the solution, heparin or saline, ordered by your healthcare provider. If you have 3 lines, you will need 3 pre-filled syringes, 3 caps, and at least 3 alcohol wipes. Once your workstation is clean and ready, wash your hands once more. At this point, you may choose to put on a pair of gloves and a mask, but it's not required unless instructed by your healthcare team.
Before removing the old cap, I'm going to go ahead and set up our new cap, and I'm going to prime it. What that means is I'm going to push fluid through the cap before placing it on the patient. So I grab my cap without touching the end, and I'm going to remove the cap on my syringe.
Put the syringe in the center of the cap, push in, and turn in a clockwise direction so it is firmly secure. Next, gently push the plunger on the syringe until you see a little bit of fluid come out of the tip of the cap. You can place the primed cap with the attached syringe down on your workstation. Before removing a cap, make sure that the clamp on that particular line is closed. The clamps prevent fluid and air from going through the lines while you're cleaning and replacing the caps.
This shows the clamp open. To close it, I'm going to press, and you'll hear a click of the clamp.
If your lines do not have clamps, you can skip this step. When you're ready to remove the old cap, hold the hub securely with one hand and gently twist the cap in a counterclockwise motion with your other hand. In this video, the hub is gray. Your hub may be another color.
So press your fingers here, and it's just a twist off motion.
Next, take an alcohol wipe and thoroughly scrub the tip or outside of the hub and the end of the lumen. Avoid scrubbing the inside of the hub. You can use additional alcohol wipes to clean the hub if necessary. Make sure you do not touch the tip of the hub with your hands, but if you accidentally do touch the tip or drop the hub itself, use another alcohol wipe and clean the hub again. Let the hub air dry. No fanning, no blowing.
I'm going to take my pre-primed cap, remove the blue end. Where the blue end came off, I'm going to place that to the end of the catheter, right at that hub. I'm going to push in and then turn clockwise until it's tight, secure, and you can't turn it anymore. Now that the syringe and the cap are attached, if there is a clamp present, I'm going to unclamp or open it. Once the clamp is open, I'm going to go ahead and flush.
Flush slow and steady. Your healthcare team will tell you the type and amount of solution to use.
And then if there's a clamp present, go ahead and close it, and then remove the syringe by turning in a counterclockwise motion.
You do not need to reflush your line on the day you are changing your caps. For complete instructions on flushing the line, refer to the section titled Flushing the Lines. Once the cap is attached, repeat this procedure for each additional line in your catheter. When you have replaced each of your caps, make sure to discard any used supplies. Remember, caps should be changed every 7 days or as recommended by your healthcare provider. Some common questions that patients have include: what if I drop my cap? If you drop your cap, throw it away and use a new one. What if I have trouble removing the old cap? If you or your caregiver are unable to remove the old cap, call your healthcare team. If this occurs at night or over the weekend, you may wait until business hours to call your healthcare team. What do I do if a cap falls off? If the cap falls off, make sure that the clamp on that particular line is closed. Scrub the hub on the affected line with an alcohol wipe and let it air dry. At this point, you should prime a new cap and follow this video's instruction to flush your line. For any other questions or problems, contact your healthcare provider or healthcare team.